there, Joe.
Good.
Mother Nature's
Good.
not a fan. How are you?
Good morning,
How's everyone
Kellyanne.
doing?
One thing that seems to be percolating right now is concerns about health insurance for people who are laid off. What is the administration's plan, given that it supports the lawsuit before the Supreme Court now on getting rid of Obamacare? How are people going to have health insurance going forward, given we have all these layoffs?
Well, first of all, let me just correct you that there's no indication that the Supreme Court will take up that case and have a decision anytime soon, as I understand it. But the president, and we thought the Fifth Circuit opinion was important, was consequential. Having said that, there are a number of different measures that HHS, CMS, Centers for Medicare and Medicaid Services, are looking at with respect to health insurance and coverage. At the same time, I think lifting these regulations so that people can get treatment, making sure that folks who need a test get a test, certainly as it means tested. There are health professionals saying, you have symptoms, we think you should get a COVID-19 test. These stand-up sites and other places that are testing our healthcare professionals and first responders first. And I have seen in the news recently, I think it was United Healthcare and one of their major insurer saying they'll pay for testing and treatment. So insurer by insurer, they're looking at that. That's very positive. But we are so busy trying to deliver these ventilators, masks, millions of pieces of supplies, billions of dollars, making sure small business owners and others get these loans or get their paperwork in the system, making sure that people who need that paycheck protection to tide them over economic dire straits through absolutely no fault of their own. We're trying to get that all engineered and executed in the next couple of weeks, as Secretary of Mnuchin and others have said. So we're looking at that, and we just want to make sure that Americans hear that we're helping them and protecting them, and at the same time, we all have a big role in this, which is not always the case when the government says we have a major challenge, or there's a major problem on our hands. We actually, through these simple mitigation techniques that may feel annoying and isolating, but are incredibly important and simple to do, we are seeing that we have a role in slowing the spread. The 15 days matter, the 30 days will matter.
Is there an enforceability mechanism on this, on the provisions in the law, essentially to allow people to not have to pay for the testing? In other words, if you go to your doctor and you get a coronavirus test, is there a way you can make sure that you're going to have your insurance pay for that?
I will ask that. I don't know if people are calling their insurance ahead of time. I actually think people are just getting the test and asking for reimbursement later, or maybe it'll be waived. As I said, you have different insurers taking upon themselves offering the testing for free. I believe we've already said people won't pay for the test. The treatment is another matter, but I've seen these insurance companies say that obviously Medicaid and Medicare are covering it. And so I will ask about the enforceability of that. But I have to tell you, we're talking about helping people and not, I haven't heard one conversation about the insurance implications at all.
Kellyanne, you just said that why doesn't Vice President Biden call the White House and offer his assistance? But we've heard from President Trump saying if he thought he had something to learn from past administrations, he'd pick up the phone and have those conversations. So does this administration want the support of previous leadership? And
well, let's talk about Vice President Biden, because I was asked specifically about him and his criticism of President Trump and the efforts that we're working on 24/7 round the clock here. And you're all covering the press conferences, the press briefings, you're talking to our health professionals, our cabinet members, the president, vice president themselves, senior staff, as you need to. So I find it to be petty and a tinge of partisanship and completely unhelpful to the American population to have a former vice president who was here for 8 years in his bunker in Wilmington just lobbing criticisms, reading from prepared notes, and not that well. When we are looking at this decidedly non-politically, I really have no time to talk about Biden and Bernie when we're talking about ventilators and vaccines. That's our focus now. So I've seen some of his interviews, if I can get through them. Painful to watch. I try to read them instead. But I haven't learned a single thing in those interviews that would help one American that we're not helping. So if he can say that, he's got a big platform. He's got a lot of fans out there who can't get enough of Joe Biden in the bunker in Delaware. So if he would actually say something in response to a question or offer an insight, we could take that up.
But when you say he's in his bunker, are you suggesting that Vice President Biden should be disregarding federal guidelines and be out there making?
No, I'm not, and you know I'm not. So let's not be silly. Let's
I'm
not be
asking
silly
when you
about it.
ask.
I'm not implying anything. In fact, I'm not implying a single thing. I wonder what you're implying, but I'm not implying a single thing other than he's out there daily now. I don't know who gave him that advice, but he's out there daily, maybe some of the Bloomberg consultants, and he's saying things that are critical and often inaccurate and false instead of trying to be helpful. If he wishes to be helpful, he can be helpful. And I have to tell you, and I'm not implying it, I'm stating it pretty clearly, the critics and naysayers, whoever they are, have never seemed so small and so shrill and so irrelevant as they do right now. When we have dozens and dozens of companies helping. We have Democratic female leaders on these governors' calls thanking the president, vice president, and saying we've had great collaboration and coordination with your task force, with FEMA, and with the government. And here's the specific ask that we need now. Could you help us? We've had person after person coming forward. We've had bipartisan, bicameral legislation come to the president's desk several times now that he has signed immediately to give relief to individuals and industries that are in specific distress, which is most of America, not all of America. And so I think that critics have never seemed so irrelevant and so small. And if you're a former vice president and you have some type of visibility, you have a great idea, let's hear it. Don't save it for the debates in September and October if he makes it there, if he's the nominee. As I say, he's the front runner. But I really have no time for Bernie and Biden when we're talking about ventilators and vaccines here. So I'm not implying anything. He can stay in the bunker all he wants. He can cough into, sneeze into his hand all he wants. He can read from prepared notes all he wants. I'm yet to hear a single idea from Vice President Biden that would be helpful to the American people or that is different from what we're doing. If he's got one, he can call me the switchboard or put him right through.
Kellyanne, a couple questions.
I know you've been in touch with the governors. They've been saying there's competition amongst them and amongst the federal government to get supplies. And we asked the president about this yesterday, and he said, you're not supposed to be competing amongst each other. Call us. But the governors say they've been told they're the ones who are responsible for getting the equipment on their own. So what should governors be doing? What's your response to this criticism or complaint among governors that they're competing amongst themselves and the federal government?
Yes, some are saying that, some are not, and here's why. And I have my notes here from the governor's call 2 days ago, and I thought Administrator Gaynor gave some very good lists, and he said, $3.1 billion so far in additional supplies, et cetera, and then he said, we also need your help. I need data from you. I need to know what your ICU and critical care bed capacity is normally. I need to know what the normal occupancy is. I need to know what the occupancy is now. I need to know what your ventilator, what are the number of ventilators available at your site. Maybe it's 0, maybe it's 4, maybe it's 50, but we need to know that. And then there are 7 things to do. And one thing he was saying is, he said here, the sourcing, if you have a contract, and we've heard this before, if you have an existing contract as the state of X with a supplier, please go ahead and keep trying to get those supplies through your regular contracting authorities. If you can get them, great, get them. If you can get them, we'll reimburse you for them, is what he is telling them. And if you can't get them, then we have the stockpile and we have ways. And we've been deploying ventilators through the stockpile, hundreds of them all week, to the different states. I think people have been mentioning those numbers at the press briefings. So I think in the regular course of business, states are saying, I need this. Some are getting them, some are not. FEMA stepping into the breach as well. And I think the great development here, and it'll take a little time to turn it over, obviously, are how many manufacturing plants and companies are converting their existing infrastructure and machinery to help, Mario, to help produce masks and ventilators and other supplies. So I think if they have any questions, they should call their 10 FEMA regional administrators that we have across this country, or FEMA itself, or ask one of us, and we'll get them. And they call constantly. They call all of us constantly, and we're happy to help them. But I think that's the. I find also there's a little bit of. It's not misinformation. It's information underload for some of these folks when they ask their questions. I'll say that as respectfully as I can. I find there's a real difference in experience and seasoning in some of the questions that are being asked on these calls.
If
the CDC decides to issue guidance on Americans wearing masks, what does that look like in practice? How do we teach Americans how to properly wear a mask? Where are the masks going to come from? How are we going to start that production? When we expect?
Sure, well, it's still hypothetical, and I'll just repeat what Dr. Fauci and the CDC have said. I mean, it's under active consideration. I'm part of some of those conversations. I will just say I think it's incredibly important to say right now that masks, the masks are more to prevent you from spreading it than protect you from getting it. It's the best way I can encapsulate it. It doesn't mean it doesn't have both benefits. What I'm saying is, as I understand it, it is more if you are infected to prevent you from spreading it than to protect you from getting it. The best way for you to protect yourself is to stay 6 feet apart from folks. And that they've just said that again and again, and it's proven effective. So I'll let the hypothetical wait until there's further action, if there ever is. But what it would look like is all of us wearing masks and teaching Americans, exactly how to do that to the extent that they would be doing it. But there's also, if people choose to do that, they can do that. But we're also, as Americans, as a country, just saying, please be respectful of the fact that we need to surge those supplies for our healthcare workers and first responders. But CDC is actively considering, nothing firm yet.
The companies that manufacture those supplies say they're waiting on guidance from FEMA about where to ship, and they don't have any guidance about where the most urgent places are, and they're not in a position to make that decision.
Well, they can send it to FEMA, and FEMA will deploy them if they prefer. We get, even staffers get calls like that every day, and we have several different clearinghouses that help us to deploy those resources as fast as we can.
So shouldn't FEMA be instructing them on where to be sending?
Well, they are, and they're working. I mean, those folks are working around the clock. So if there's a particular company or 2 or 5 that don't know, and again, some of them call me directly, and I'm a staffer, they certainly call Peter Navarro, they call FEMA, they call, where do we put these? And we get the responses right away. So if they want to call, they can. If they want to talk to the media, they can. If they want to call us, they can.
And a question on Florida, because the president's message is so dire. Is he considering asking DeSantis to order people to stay at home? And
well, we have federal guidelines that everybody should be following, and on top of those, you have state guidelines. So every state has acted differently. You see what as my kids call it, the DMV, DC, Maryland, and Virginia have done around here in coordination now. Pretty strict penalties as well for violating these demands by the District of Columbia and the 2 neighboring states. So every state is making that decision. I think some states did it early, like Ohio. I think some states are coming along a little bit later. I will say, just generally to repeat what Dr. Birx said yesterday in the briefing, which is, I'd like to show you how mitigation works as we extend this to the next 30 days. States that did it early, like Washington, California, have seen positive results. States that did it a little bit later, I think she said New York and New Jersey, as an example, are seeing some benefits, but they were delayed, obviously. So I think that's an important message for everyone in every state, generally speaking, that the mitigation works and that lockdown order, stay at home is working. And so far, I mean, I really have to commend the American people. They've been terrific. They're complying. I know there are a couple of places that didn't, or people that didn't. We're always going to have that in a great democracy of 330 million plus people. But Americans have been terrific in terms of making that sacrifice and being part of the solution, and they'll continue to. So.
Could you explain one more time why it is that the federal government, the president, just sort of doesn't step in and offer one-size-fits-all solutions? For example, ordering coast to coast that everybody stay home, or preempting
the president has addressed this, and we know, and the health professionals up there every day taking your questions. They have recommended 30 days.
But I'm talking about state versus federal.
30 additional days 30 days to slow the spread, and states on top of that are making their own decisions based on their infection rates, based on their clusters, based on what they see and what they hear.
Is it philosophical? Is it logistical? Why is it that the president doesn't step in?
The president steps in and steps up every day, Joe. Excuse me.
But he could just
We're
wave a
working around the
wand,
clock
right?
here. Right, and if you did, you'd criticize him for not respecting federalism and democracy. You'd say, we're not China. Well, you probably wouldn't, but we're not China. We're the United States of America. So he's taken the guidance and conferring with many different people, and we want people, first and foremost, to understand that the sacrifice they made the last 15 days to continue the next 30 will absolutely save lives and make a difference. Anyone else?
Kellyanne, how do you see this? This is all occurring, of course, with the backdrop of the election. Joe Biden, I think yesterday, suggested maybe some doubt about holding the Democratic convention. How does this impact the overall campaign and the election?
Well, he's not even the nominee, but I really have no time for Biden and Bernie. I've been talking about ventilators and vaccines, but if he wants to talk politics, I guess he can. I see all the articles, he can't raise any money, and he's trying to put sentences together and read from prepared notes in Wilmington, Delaware, in the converted recreation room, I guess, and that's up to him. I'd love to hear from him what his solutions are for a global pandemic. I've heard nothing. The man was in government for decades and decades and decades and decades. He was in the Senate for decades and decades and decades and decades. He was vice president, worked in this building for 8 years recently. And if we had one solution for every 5 criticisms he lobs, we might be in a better place. So that's what I would ask him today. If you have a great solution, let's hear it.
And the polls, the president has really grown in the polls, increased in the polls. What do you attribute that to during this time?
Well, it's a great question. I've had this conversation directly with the president. He's at 61% in the Gallup poll for his handling of COVID-19. He never had as high approval rating on the economy, and certainly deserved it. The economy was humming along, and it's a Trump economy between the deregulation, the tax cuts and job production, the trade deals, the energy dominance. But people expect Donald Trump. He's a businessman. That's why you got elected. It's part of why you got elected. Lots of reasons. But they expect Donald Trump to help fix the economy, make it better. But this was handling a global pandemic. It's not something that people had anticipated, and it is the president. The approval rating of his handle on COVID-19 is higher than his overall approval rating and on some of the other issues. And I attribute it to the fact that he gets out there every day and tells people, here's what happened today. For example, the FDA in the last week or two, maybe the last week, has issued emergency approval of 3 incredibly important measures that will save lives and mitigate damage to Americans. Sanitizing the ventilators, using the convalescent plasma, and the rapid test that you get your results within minutes, positive or negative. I mean, it would take years in the past to get approvals on things like that. And now we have emergency approval. We have the Centers for Medicaid and Medicare waiving all this red tape and regulations for the hospitals and healthcare workers that is literally allowing them to treat patients and to not worry about reimbursement on the back end. We have FEMA. We have the whole health team, and the president is making them all available. They're all part of it. It's not just him. He's leading it. The vice president's leading the task force. The president's leading the briefings. But he's making everybody available. Different cabinet secretaries saying, labor saying, here's what we're doing for displaced workers. Education saying, here's what we're doing for the students. USDA saying, here are the 1 million meals we're going to deliver to rural students who are on the SNAP program and don't have the nutrition because they're not in school. So whole of government, whole of America with specificity. And people are tuning in to learn. I think people want information. They can't get enough information about COVID-19, how they can help, what they can do. And I hope people are availing themselves of these small business loans, of the money that's available. Don't look at it as a government handout. You deserve it. You're in economic distress. Don't be proud. It's patriotic for America to be helping Americans. All of us should be doing that. So, and it's something I've discussed with him, and it's I think there's just no time for politics. So again, my message to Vice President Biden is, if you had one solution for every 3 or 5 criticisms, give us a call. They'll put your call right through. Thanks. Take care.
Thanks, Kellyanne.
All right, folks, thank you so much for joining us here at Golden State Times. If you liked our coverage of Kellyanne Conway's press briefing that she had outside of the White House, then make sure you share it on social media and you click the thumbs up button. If you're new to the channel, we encourage you to subscribe and click that notification bell. President Trump will be having a press briefing on coronavirus from the press briefing room later on today. It will be pinned to the top of the comments, so you can go and check it out through there. Also, it should be coming up on your screen. It's interactive. Just click on it, and then it'll take you to where the live stream is going to be. We hope that you guys join us later on today for President Trump's press briefing. Don't forget, click the subscribe button and the notification bell That way you can hopefully get notified by YouTube when we go live. If you want to get notified directly by me here at Golden State Times, then all you have to do is go to our website, goldenstatetimes.com. Again, that's www.goldenstatetimes.com. Sign up to our newsletter, and I'll send you a notification directly to your cell phone, to your email, that we are live, or there's a new press briefing, there's a new speech, anything like that. So if you are interested in that, make sure you go to our website, goldenstatetimes.com, and also follow us on Twitter at Gold State Times. Again, that's gold, not golden, at Gold State Times on Twitter. Thank you so much, folks, and we'll see you soon. Peace.